Did you know that over 900,000 Americans suffer from blood clots every single year? And nearly 100,000 of them die because they didn't spot the silent warning signs in time. That tingling in your feet, those sudden muscle cramps waking you at 2 a.m., or that heavy dragging feeling in your legs when you stand too long, they might seem harmless. But they could be your body's desperate cry for help, signaling that your circulation is slowing down. And blood clots could be forming right now. Poor blood flow isn't just exhausting. It's a ticking time bomb that raises your risk of stroke, heart attack, and serious complications as you age. But here's the good news. In this video, you'll discover 6 common vitamins scientifically shown to help dissolve dangerous blood clots, protect your blood vessels, and keep your legs feeling strong and pain-free. Don't wait until it's too late, because sometimes one small daily change can mean the difference between life and tragedy. Before we dive in, don't forget to like, share, and subscribe to Senior Life. When you're over 60. Poor blood circulation isn't just a minor inconvenience. It can seriously affect your daily life in ways you might not expect. For many older adults in the U.S., reduced circulation means more than just cold feet or tired legs. It can slowly chip away at your independence. Simple things like walking to the mailbox, standing while cooking, or keeping up with grandkids become harder, not because you're just getting older, but because your muscles and nerves aren't getting the blood flow they need to function properly. Poor circulation also weakens your body's ability to heal. A small cut on your foot might take weeks to close up, and in some cases it could lead to infections or even ulcers, especially dangerous for seniors with diabetes. It can also mess with your sleep. Cramping restless legs, or that nagging heaviness, can keep you tossing and turning all night, leaving you exhausted the next day. Worse yet, when circulation is poor, your heart has to work overtime just to push blood where it needs to go. That extra strain can raise your risk of high blood pressure, heart disease, and even stroke. And let's not forget mental clarity. Your brain needs healthy blood flow too. Many seniors don't realize that chronic poor circulation can contribute to forgetfulness, brain fog, or feeling off mentally. In short, ignoring circulation issues can quietly steal away your quality of life. But the good news: it's not irreversible. With the right habits, nutrition, and early action, you can support healthy blood flow and feel stronger, more alert, and more confident doing the things you love every day. Right now, let's explore 6 essential vitamins that help improve blood circulation and dissolve blood clots, especially important for seniors to know. Number 6. Vitamin B12. Here's a shocking truth. Nearly 1 in 6 people over 60 in the U.S. has low vitamin B12, and many don't even know it until serious damage is done. The National Institutes of Health (NIH) estimates that about 15% of adults over age 60 in the United States have a B12 deficiency. Globally, it's even higher in some regions. Studies in Europe and Asia have found rates between 20% and 30% among older adults. That's millions of seniors who might be tired, foggy, or even at risk for permanent nerve damage, all because of low B12. One study published in the American Journal of Clinical Nutrition found that older adults with low B12 were nearly twice as likely to experience cognitive decline and memory problems compared to those with healthy levels. That's huge. Another research piece in Neurology reported that B12 deficiency can cause brain shrinkage, literally shrinking parts of the brain involved in memory and thinking. I remember a patient, Mr. Carter, 68 years old. He came in complaining he was so exhausted he could barely get out of bed. He thought it was just aging. His wife noticed he kept repeating himself in conversations. His blood work showed critically low B12 and elevated homocysteine levels, which increase the risk of heart attacks and strokes. We treated him with B12 shots, and within a month he felt like himself again. His wife said, "It's like I got my husband back." Here's the thing. B12 is essential for creating healthy red blood cells. Without it, you can develop a type of anemia called megaloblastic anemia, where your red blood cells become too large and can't carry oxygen well. That's why low B12 often shows up as fatigue, weakness, shortness of breath, and even heart palpitations in older adults. And B12's job doesn't stop there. It plays a crucial role in keeping your nerves healthy. The protective coating around your nerves, called the myelin sheath, needs B12 to stay intact. Without it, you can get that scary tingling numbness or burning sensation in your hands and feet. Over time, this nerve damage can become permanent. Now let's talk homocysteine, a chemical in your blood. High levels are linked to heart disease, stroke, and even dementia. B12 helps keep homocysteine levels low. A large meta-analysis in Circulation Journal found that reducing homocysteine levels with B vitamins, including B12, could lower the risk of stroke by up to 20%. That's a big deal if you're trying to protect your heart and brain as you get older. Quick side note, if you're taking medications for acid reflux like proton pump inhibitors, PPIs, or metformin for diabetes, your risk of B12 deficiency goes up. Those meds can interfere with how your stomach absorbs B12. So if you're on those long-term talk to your doctor about checking your B12 levels at least once a year, the good news: B12 is easy to get from your diet. Red meat, eggs, milk, poultry, and fish are excellent sources. But for some older adults, food alone isn't enough, especially if their stomach isn't absorbing B12 properly. That's where supplements, pills, sublingual drops, or even injections come in handy. The NIH recommends that adults over 50 consider getting most of their B12 from fortified foods or supplements because age-related changes in the stomach make it harder to absorb natural B12 from food. And it's safe your body flushes out what it doesn't need. So here's my advice. If you're over 60 and feeling tired, forgetful, off balance, or noticing numbness in your hands or feet, don't ignore it. Ask your doctor to check your B12 levels. A simple blood test could save you from serious health problems down the road. Number 5. Vitamin B6. Here's a fact that surprises a lot of folks. Studies show that people with low vitamin B6 levels have up to a 30% higher risk of stroke and heart disease, and many have no idea their levels are even low. Vitamin B6 helps keep levels of a compound called homocysteine under control. High homocysteine is a big deal. According to the American Heart Association, elevated homocysteine can damage the lining of arteries, make your blood more likely to clot, and double your risk of heart attacks and strokes. A large study published in the American Journal of Clinical Nutrition found that adults with higher B6 levels had a 24–30% lower risk of cardiovascular disease compared to those with low levels. Another meta-analysis from the Journal of Nutrition found that increasing B6 intake could lower homocysteine levels by as much as 12–15%. That's significant when you're talking about preventing blood clots and protecting your brain. Now let's talk about the brain. B6 is vital for producing neurotransmitters. Those are the chemicals that help brain cells communicate. Low B6 levels can contribute to depression, irritability, brain fog, and even memory loss. The National Institutes of Health (NIH) reports that seniors with lower B6 levels are at 35% higher risk of cognitive decline. There's even research from the Archives of Internal Medicine showing that older adults with higher B6 intake scored better on memory and cognitive tests over time. In other words, keeping B6 levels up may help protect against dementia as we age. Another area where B6 shines is nerve health. It helps maintain healthy nerve function and prevents that tingling, burning, or numbness many older adults describe in their hands and feet. Chronic low B6 can damage the protective coating around nerves called the myelin sheath, leading to long-term nerve problems. A study from the European Journal of Neurology found that individuals with low B6 were significantly more likely to report peripheral neuropathy. That's the fancy term for nerve pain and numbness compared to people with normal B6 levels. And don't forget your immune system. As we age, our immune defenses weaken naturally. B6 helps make white blood cells and antibodies that fight off infections. Researchers from Tufts University discovered that seniors with low B6 had weaker immune responses and took longer to recover from illnesses like colds or respiratory infections. One study in Nutrition Reviews even linked low B6 to a higher risk of inflammation-related diseases, including rheumatoid arthritis and some cancers. That's why I always remind my older patients that nutrition is one of the simplest medicines we have. Here's a quick reality check. If you're over 60, your risk of B6 deficiency goes up for several reasons. As we age, our body becomes less efficient at absorbing and using B6. Medications like certain blood pressure drugs, antiepileptics, or long-term corticosteroids can also lower B6 levels. So even if you're eating relatively well, you could still be low. Symptoms of low B6 can be subtle at first: unexplained fatigue, mood changes, depression, tingling, or numbness, or frequent infections. Many patients brush it off as just getting older, but sometimes it's simply a vitamin deficiency that's easy to fix. The good news is that B6 is found in plenty of foods: bananas, salmon chicken, turkey potatoes, chickpeas, and whole grain cereals are all great sources. The NIH recommends that adults over 50 get at least 1.5 mg of B6 per day, but some people may need a bit more, depending on health conditions or medications. And B6 supplements are generally safe when used at recommended doses. Number 4. Vitamin D3, a vitamin essential for everyone, not just seniors. Let's dig into the heart and circulation. Vitamin D3 helps regulate something called the renin-angiotensin-aldosterone system, or ERAS for short, which controls your blood pressure and fluid balance. When vitamin D is low, that system can go into overdrive, causing blood vessels to constrict and your blood pressure to rise. A huge meta-analysis published in Hypertension Journal found that people with low vitamin D levels had a 30% higher risk of developing hypertension. Meanwhile, a separate study in the American Journal of Cardiology discovered that bringing vitamin D levels up to at least 30 mg/ml could lower blood pressure by an average of 4 to 5 points systolic. That might not sound huge, but for many seniors that can be the difference between controlled hypertension and needing extra medications. Now let's talk about blood clots. Vitamin D3 has powerful anti-inflammatory effects on the inner lining of blood vessels, the endothelium, and helps keep your blood flowing smoothly. Inflammation in these linings makes it easier for clots to form. A 2020 systematic review in the Journal of Thrombosis and Hemostasis found that low vitamin D levels double the risk of venous thromboembolism (VTE), that's deep vein clots, which can break off and cause deadly pulmonary embolisms in the lungs. Globally, studies from Europe, Asia, and the Middle East show that vitamin D deficiency rates in older adults often exceed 70–80%, especially in regions with less sun exposure or cultural practices like covering the skin. Those same populations often see higher rates of VTE and cardiovascular disease. Let's shift gears. Vitamin D3 also plays a crucial role in keeping your endothelium flexible. The endothelium isn't just a passive lining, it actively controls how your blood vessels expand and contract. A study from Harvard Medical School showed that maintaining vitamin D levels above 30 ml improves endothelial function by about 20%, meaning your blood vessels relax better, reducing strain on your heart. There's also a connection between vitamin D3 and systemic inflammation. Chronic inflammation is like a smoldering fire that damages tissues throughout the body. Low vitamin D is linked to elevated markers like C-reactive protein (CRP). A study in Circulation Journal found that people with sufficient D levels had CRP values up to 40% lower than those who were deficient, suggesting less inflammation and a lower risk of cardiovascular disease. And we can't forget the immune system. Vitamin D3 helps activate immune cells that fight infections but also calms them down to prevent overreactions. Seniors with low vitamin D levels have higher risks of respiratory infections. A major global analysis published in BMJ in 2017 showed that vitamin D supplementation reduced the risk of acute respiratory infections by about 12% overall, and the protective effect was strongest in people who were severely deficient. Another fascinating connection emerging studies suggest that vitamin D3 may even help prevent atrial fibrillation AFib, a common heart rhythm problem in seniors. A 2021 review in Nutrients found that people with low vitamin D had a 30% higher risk of developing AFib, which can lead to strokes. But here's the thing, symptoms of low vitamin D3 can be sneaky. Fatigue, muscle weakness, bone aches, frequent infections, or even feeling blue. Many seniors chalk it up to just aging, but sometimes it's simply a fixable vitamin issue. Where can you get vitamin D3? The sun is your best friend, about 10-30 minutes of sunlight. A few times a week helps your skin produce D3 naturally, but after age 65, your skin makes 75% less vitamin D than when you were younger. That's why deficiency skyrockets in older adults. Dietary sources include salmon, mackerel, sardines, egg yolks, and fortified dairy or cereals. But food alone often isn't enough. The NIH recommends that adults over 70 get at least 800 IU per day, but some researchers argue many older adults may need 1,200 IU daily to maintain blood levels above 30 mg/ml. The Endocrine Society even suggests up to 4,000 IU day is safe for those who are deficient, always under a doctor's supervision, of course. My advice, get your vitamin D checked at least once a year, especially if you're over 60. It's a simple blood test, and fixing a deficiency can be life-changing. Lowering blood pressure, protecting your veins, supporting your immune system, and maybe even lifting your mood. Number 3. Vitamin B3. Vitamin B3 plays a powerful role in cardiovascular health, and it's especially important for seniors. It helps dilate small blood vessels, capillaries improving blood flow to the limbs, brain, and heart. That means better oxygen delivery and reduced risk of numbness, tingling, or even ulcers in the legs, all common problems in older adults. According to the Centers for Disease Control and Prevention, CDC peripheral artery disease, PAD reduced blood flow to the limbs affects 12 to 20% of Americans over 60. And one key modifiable factor, niacin intake. A 2019 review in the Journal of Clinical Lipidology showed that niacin supplementation significantly improved blood flow in older patients with PAD, reducing leg pain and increasing walking distance by up to 60%. We started him on a niacin-rich diet, tuna, turkey, peanuts, plus a time-release niacin supplement. Within 2 months, his HDL went up to 43, and he told me, "Doc, I can walk the neighborhood without sitting down every 5 minutes." That's quality of life restored. Let's talk about cholesterol for a second. Niacin is one of the few nutrients proven to raise HDL, good cholesterol. According to a large study published in the New England Journal of Medicine, niacin can raise HDL levels by 15% to 35%, while also lowering LDL bad cholesterol and triglycerides by 20% to 50%. In fact, the Coronary Drug Project, which followed over 8,000 men with heart disease for 6 years, found that those taking niacin had a 27% lower rate of non-fatal heart attacks compared to placebo even before statins became common. Years later, those same men had a 11% lower total mortality rate. That's remarkable. Globally, data from the World Health Organization (WHO) and European Food Safety Authority (EFSA) also highlight B3's role in maintaining vascular tone and preventing hyperlipidemia, especially in aging populations. Countries with higher dietary intake of niacin-rich foods consistently report lower cardiovascular mortality rates, particularly in seniors. What's happening at the cellular level? Niacin enhances endothelial function. That's the ability of your blood vessels to expand and contract. It reduces oxidative stress and vascular inflammation, both of which are major drivers of atherosclerosis, hardening of the arteries. A 2020 study from the American Journal of Physiology confirmed that niacin improves nitric oxide availability, essential for relaxed, healthy arteries. But the benefits go beyond the heart. Niacin also supports brain health by increasing blood flow to the brain and enhancing energy production in neurons. Research from Oxford University found that niacin supplementation slowed cognitive decline in patients with mild cognitive impairment (MCI), particularly those over 65. Vitamin B3 deficiency, while rare in its severe form, pellagra, is often subclinical, meaning you may not feel sick, but your body is already struggling. Early signs include chronic fatigue, brain fog, cold or numb hands and feet, low HDL on blood work, cramping or pain while walking, mild depression or irritability. Older adults are especially vulnerable. According to the National Health and Nutrition Examination Survey, 1 in 3 seniors in the U.S. do not meet the recommended dietary intake of niacin. Factors like poor diet, alcohol, use certain medications like isoniazid chemotherapy, drugs or diuretics, and even digestive issues can reduce B3 absorption. So what should you eat? Great niacin sources include turkey, chicken breast, tuna, salmon, beef, liver, peanuts, and whole grains. Fortified cereals also help. The recommended daily intake for older adults is around 14-16 mg per day, but therapeutic doses, especially to raise HDL, are usually higher and should be prescribed. One thing to know, niacin flush, a warm tingling, sometimes red flushing of the skin, is common when you start taking higher doses. It's not dangerous, just surprising. That's why slow-release forms or inositol hexanocotinate versions are often better tolerated. Number 2, vitamin C, a very familiar vitamin to all of us. Did you know that nearly 1 in 4 older adults in the U.S. have vitamin C levels below optimal, quietly weakening their blood vessels, slowing healing, and raising their risk of blood clots? One of the most vital roles of vitamin C is its ability to stimulate collagen production. Collagen isn't just for skin, it's the main protein that holds your blood vessel walls together. Weak collagen means fragile capillaries, poor circulation, and higher risk of internal bleeding or bruising. A study published in the American Journal of Clinical Nutrition found that low vitamin C status was associated with increased arterial stiffness, particularly in people over 65. The researchers noted that older adults with higher vitamin C intake had better endothelial function, meaning their arteries could expand and contract more easily, promoting better blood flow and reduced blood pressure. In fact, a meta-analysis in the European Journal of Clinical Nutrition 2020 showed that daily vitamin C supplementation, typically 500 mg per day, resulted in a 3.84 mm reduction in systolic blood pressure and 1.48 mg/mm in diastolic pressure. These changes are modest but meaningful, especially for seniors already managing hypertension. Now let's talk about blood clots. Vitamin C supports your body's natural ability to dissolve microthrombi small clots that can form in the veins or arteries. Research from the University of Cambridge found that vitamin C enhances the function of nitric oxide, which helps keep vessels open and reduces platelet aggregation, the clumping that leads to clot formation. A 2019 study in Frontiers in Physiology showed that elderly patients with sufficient vitamin C had faster fibrinolysis, meaning their bodies were better at breaking down tiny clots before they became dangerous. That's incredibly important in preventing conditions like deep vein thrombosis, DVT, and stroke. Globally, deficiency is more common than many realize. According to the World Health Organization, WHO, up to 30% of older adults worldwide may have marginal vitamin C status, especially in regions with low fruit-vegetable intake or poor food access. Even in the U.S., NHANES data shows that 20–25% of people over age 60 don't meet the recommended daily allowance, RDA, for vitamin C 90 mg per day for men, 75 mg per day for women. Let's not forget oxidative stress. As we age, our bodies generate more free radicals, unstable molecules that damage tissues, including blood vessels. Vitamin C is one of the most powerful antioxidants we have. It neutralizes free radicals and reduces inflammation inside artery walls, which can otherwise lead to plaque buildup, atherosclerosis. A randomized trial from the University of Colorado found that daily vitamin C intake, 501 reduced C-reactive protein CRP, a major inflammation marker, by up to 25% in older adults. That's a big deal, considering CRP is linked to higher risk of heart attack and stroke. Here are some common warning signs of low vitamin C in older adults. Easy bruising or petechia, tiny red dots on the skin, bleeding gums, slow wound healing, fatigue and weakness, cold or aching limbs, recurrent infections, dry splitting skin, or fragile capillaries. Number 1. Vitamin E. The final one we need to pay close attention to. Here's a surprising stat: nearly 94% of Americans don't meet the recommended intake for vitamin E. And in older adults, that shortfall could quietly increase the risk of blood clots, stroke, and cardiovascular damage. Let's start with what vitamin E actually does. Specifically, we're talking about D-alpha tocopherol, the most biologically active form. It's a fat-soluble antioxidant, which means it neutralizes free radicals, unstable molecules that damage cells, especially in the lining of your arteries and capillaries. But more than that, vitamin E helps regulate platelet aggregation, the process by which platelets clump together. That's essential for stopping bleeding when you're injured. But when platelets overreact, they can form unwanted clots that block blood flow. A 2021 review published in the journal Antioxidants concluded that vitamin E significantly reduces platelet adhesiveness, particularly in people over age 60. Another study in the Journal of Cardiovascular Pharmacology showed that regular vitamin E intake decreased clot formation in high-risk patients by as much as 33%. According to the National Institutes of Health, NIH, the recommended dietary allowance, RDA, for adults is 50 mg of alpha-tocopherol per day. Yet data from the NHANES National Health and Nutrition Examination Survey reveals that more than 9 out of 10 Americans fail to hit that mark, largely due to low nut seed and healthy oil intake. Internationally, the issue is just as serious. A global review published in Nutrients 2020 found that 82% of older adults in Europe and 75% in parts of Asia have vitamin E intakes well below the estimated average requirement, EAR. This deficiency has been associated with increased oxidative stress, poor immune response, and higher incidence of thrombotic events, blood clots. So how exactly does vitamin E help prevent clots and protect arteries? It works through multiple mechanisms, inhibits platelet aggregation, reduces stickiness, protects endothelial cells, cells lining your blood vessels from oxidative damage, preserves nitric oxide, a key molecule that helps arteries stay flexible, reduces C-reactive protein CRP, an inflammatory marker tied to heart attack and stroke. A clinical trial conducted at Tufts University showed that vitamin E supplementation 400 IU day in older adults reduced CRP levels by 20–30%, especially in individuals with existing cardiovascular risk. Lower CRP means less inflammation, and inflammation is the real fuel behind many age-related diseases. But it doesn't stop at blood vessels. Vitamin E also protects your red blood cells, keeps your brain tissue resilient against aging, and helps muscle function, which explains why fatigue and weakness are common signs of deficiency. Other signs you might be low in vitamin E include tingling or numbness in your hands and feet, peripheral neuropathy, frequent bruising or slow wound healing, dry flaky skin, or fragile capillaries, muscle weakness or sluggish reflexes, general fatigue and brain fog. Fortunately, vitamin E is found in many foods, you just have to know where to look. Wheat germ oil, 1 tablespoon, 20 milligrams, sunflower seeds, 1 oz, 7 mi, almonds, 1 oz, 7, 3 milligrams, hazelnuts, avocados, spinach, pumpkin, olive oil, safflower oil, peanut butter. Pro tip: since it's fat-soluble, vitamin E needs fat to be absorbed properly. So eat it with avocado nuts or drizzle a little healthy oil over your vegetables. Supplements are also helpful for some people, especially those with absorption issues or limited diets. But dosage matters. Studies suggest 200–400 IU day of D-alpha tocopherol is safe and effective for most older adults. However, higher doses above 1,000 IU should only be used under medical supervision, especially if you're on anticoagulants or blood thinners. My advice: if you're over 60 and have a history of clotting issues, frequent bruising or circulation problems, ask your doctor to check your vitamin E levels. It's often overlooked but incredibly important. So, after learning about vitamin B3, B6, B12, C, D3, and E, one thing is clear: these aren't just nice-to-have nutrients. They're the unsung heroes quietly protecting your heart, your circulation, your brain, and your strength as you age. Whether it's breaking down blood clots, boosting oxygen flow, or simply keeping your vessels strong, the right vitamins can make a real difference. Don't wait until symptoms show up. Start paying attention today. Add those powerful foods to your plate. Talk to your doctor. And most importantly, take action before it's too late. If you found this helpful, share it with a friend. And if you care about living strong in your golden years, don't forget to like, subscribe, and hit that bell so you never miss an update from Senior Life.